Hey, what's up, everyone? It's Dr. Glenn Vo. I am super excited to have a founder of a really cool product. I think it's going to actually change the way we take care of our patients. Now, look, not everybody likes going to the dentist. Now, can you imagine like a kid? I remember as a kid, I did not like, well, part of the reason why I became a dentist was with my actually experiences as a kid. It wasn't the most, you know, it was kind of traumatic, let's put it that way. But this new product, what they're doing is so amazing. I have Jean, who is the founder of Paper Plane Therapeutics. And this good looking man also here, you might recognize him, is Ian Miller. He works with a lot of different companies, but I call him the CRO of Dentistry, right? He works with a lot of different companies. He's amazing. They're both here to talk about Paper Plane Therapeutics. Guys, welcome to the podcast.
Thank you so much, Glenn. I appreciate you having us.
Yeah,
So,
thanks for having us.
so John, I mean, again, before we dive in, what does paper plane therapeutics do? I led with the fact that it's going to change how we take care of our patients. And I'm sure all the dental professionals watching right now, they're wondering, okay, what is this amazing product? Because again, just to let you know, as dentists, we always get pitched the next amazing product, right? All the time. Hey, doc, we got this amazing product. But as someone who works with a lot of different companies, someone who runs Nifty Thrifty Dentists, I actually demoed this myself. I do feel it's going to change the way we take care of our patients. But John, if you can just share with us what it is and why did you decide to work with people in dentistry? Because we're pretty crazy, right? Like so there has to be an angle there. So let's start with what Paper Plane Therapeutics, what you guys do, and why did you decide to work with dentists?
Yeah, so we do therapeutic virtual reality for pain and anxiety management. So I'm an ER physician, graduated in 2013. I did my research project as a medical resident on the use of VR for pain and anxiety management. And that was back then, the Oculus developer kit just came on the market. So we were switching from bulky lab equipment to something that looked like it's going to be a lot more consumer oriented and user friendly. And so for the better part of the coming years, and as I worked as an ER physician in a pediatric hospital in Montreal, and then in a community hospital as well, I faced the same challenge that dentists face, which is caring for patients, especially kids, is hard when you need to do a needle poke, some sort of procedure, just examine them. Sometimes it's hard. And the truth is, we didn't have a lot of options. Sometimes, just like dentists, you get nitrous oxide, but you're getting to something a bit more challenging. And then there's medication, works great, but there's side effects. Everything's more complicated when you start using medication. And we're always told to use non-pharma approaches, but that's easier said than done.
Yeah.
And so I figured that my research project could be turned into a product that could be used. So for about 5 years, we conducted R&D and then clinical trials at the pediatric hospital, Saint Justine in Montreal. And in 2019, we founded a company focusing mostly on hospital use for patients 5 years old and up. But as of last year, we launched the product for dental, which was something that we really wanted to tackle, but we needed to, better the products because it's more complicated working right underneath the mask with a patient lying down. So all the experience that we gathered over the years allowed us to come up with this product for dentistry and finally launch in that market. And we're really happy about the results so far.
Well, so first of all, thank you so much for sharing that background because I just want to let everyone know that this is not just some guy off the street that was just decided, hey, let me create a product to make, taking care of pediatric patients a lot easier. He actually has real world experience, turned it into like the research product. And I'll tell you what, like whenever, the times I had to take, like my kids to the ER for something, like they're very scared, right? Like they don't know what's going on. There's a lot of anxiety there. So I can only imagine. And again, with the fact that a lot of times maybe you just need to get like a specimen or something like that, and it's really quick, right? So it doesn't make sense to sedate somebody like that and run through all the risks. So I appreciate the real world experience that you bring as well. And then of course, bring this in. Now, before we even show what it looks like, because I know people are dying to like, what does he have? Like, let's take a look at it. Ian, you've worked with so many different companies. We got to know each other because you work with so many different companies that take care of so many dental practice, a bunch of different dental practices. What made you so excited to really want to join this journey with Jean with Paper Plane Therapeutics?
I had a very similar experience like you did with your kids, but when I was a child, I used to go to my dentist. My mom would send me up as a 12-year-old. I would register and say, can I go to the bathroom first? I'd run down to the bathroom and stay there for 45 minutes. I would not come out. I was petrified. I had true dental phobia. And of course, it never worked because 45 minutes later, they knew my shtick. And when I went up there, they would, freeze me or numb me at that time, and I was done. But when I heard of the technology, I had seen something in the newspaper locally here. I just had to call up Jean-Simon and just say, hey, I've got the vehicle to get your product to market. You've got the product. This is a marriage made in heaven.
Yeah, I love that. And I love the fact that you tied that to like a personal story. And I think we all, in a certain part of our lives, right, has some kind of phobia, whether it's dental, whether it's medical, or just the anxiety of it, like not understanding what's going to happen next, right? Like now, of course, on you being a physician, myself being a dentist, like we've gone through the training, we understand, right? Now, most of our community, they don't understand that part. Now, take that to another level and think of it as a child, right? And who knows what the siblings have been trying to say, whisper. Look, I mean, our siblings, sometimes they're there to just scare the crap out of us sometimes. But like, imagine going through all that. So with that being said, John, I'd love to share with our community. And again, we'll talk about like the different components, the actual software that comes in with it, the actual science. But can you just show us like what a normal VR unit that you guys send out through Paper Plane Therapeutics to these dental practices?
Of course. So yeah, the most important part is the headset itself. So this is a headset that's well suited for a healthcare application because it's really easy to clean. So everything is non-porous, kind of
Mm.
PU foam or plastic. In this case, the foam, you can just remove it. You
Oh,
can
wow.
wipe it with a cavi wipe, anything you use to disinfect your other equipment. And then the rest, you can also give it a good wipe all the way around. The only thing that's a bit more sensitive where you want to use products for glasses or eyewear is on the lenses. But usually they're not in contact with the patient. So you just remove the mask, you wipe it down, and then like I did, it's just magnetic, you clip it back, and then that's it. In terms of the system itself, there's a camera in the front so that on the tablet that you have that comes with the unit, there's always the option of having the see-through function. So you kind of
Mm.
see an AR or you see through the glasses. So if you need to pause, talk to the patient for a couple minutes, show them something, you click on a button on the tablet, that's your kind of remote for the whole system. They see you, you can talk, and then once they're going back in, you just press play and
Oh,
then you're
okay.
done. So you don't have to remove the equipment if you're already well.
So they
uh,
can keep it on the whole time.
yeah. Yeah, exactly. So the best use case for that is when the assistant or the hygienist welcomes the patient, they sit them down, they install the system, which takes less than a minute, by the way. Just once you decide to grab the system, put it on the patient, it's already good to go. As you open it up, you power it on. You don't have to look through the headset, go through the menus, click yourself. No, you power it on, it's ready to use. You just put it on the patient, and then the tablet connects automatically to the headset, and then you're good to go. Less than 60 seconds after a short while of getting used to the system. And then when the dentist walks in, usually going from room to room because they're quite busy, you can just use the see-through function, say, hi, how's it going? If it's not something that's complicated or it requires like a long 10, 15-minute conversation, if it's just like, all right, ready to go, let's do it. And then you press play and then you just get to work. So for us, we understand that is really important for dentists because it's also really important for any healthcare professionals. High volume, not a lot of time to perform the procedure, always more tasks for whatever reason, if it's charting and welcoming the patients and doing all the stuff required for a procedure. So we understand that speed to getting started is really, really important. And we always keep the physicians, the nurses, the assistants, everyone who uses our product, they're top of mind because if they don't use it, patients don't benefit from it. So in order for that to reach the patient, we need to make sure that the healthcare professionals are happy using it.
Well, John, I mean, I think there's a case to be made, and I'd love for you to share just some case studies because, again, you've been very careful about how you actually launch this, right? Like, you've got proof of concept in the medical field, and then you've worked with some practices in Canada, and you've been very careful about getting proof of concept before pushing, making a big push like you're about to do right now. Based on the experience that you had, as far as like working with these dental practices, did they actually save time using this product? Because again, working with kids, there's some behavior management, right? And depending on how effective you are, that could add some extra minutes to every procedure time. Have you noticed that actually practices that implemented this actually saved time and actually got ahead of their schedule because they were able to calm down their patients earlier?
Yeah, absolutely. So the what we get from a lot of our clients is between 5 to 10 minutes per patient per
Wow,
hour of procedure. And since putting
that
on the
adds up
headset,
a lot.
yeah, yeah. At the end of the day, some dentists you see a lot of kids, but also adults. Sometimes they don't look nervous, but they'll ask questions. They'll interrupt in some way in order to kind of
And
kind of
some
push
people
back
just
the
go hide in
inevitable.
the bathroom, right?
Yeah,
Okay.
exactly. So a lot of dentists, especially with kids, it's more obvious. It's more evident that they say between 5 to 10 minutes, and they say that since putting on the headset doesn't require like more than a minute, everything you save down the line is just time saved on your schedule. So that's the one that we really love to share because I think it's really important for dentists to understand that obviously for patient satisfaction it's through the roof. I mean, patients really love it, but not only is it not adding time to your schedule, it's actually shaving off minutes, and they add up at the end of the day. The other thing that we notice is that, well, in terms of the workload for healthcare professionals, so dentists, hygienists, assistants, just makes their day easier because the patients are
Mhm.
more comfortable. They don't get the patient's anxiety coming onto them. So they just feel that at the end of the day, if they saw a lot of kids, but everyone had a good time, left with a big smile on their face, they're like, I just don't feel as tired. It's
Yeah.
that compassion fatigue that builds over time is directly related to the having your patient anxious and not being able to kind of fully take care of it because sometimes it's just hard if you lack the right tools. The other thing is that patients, and then we can come back to how the science work, but they do mention that time feels shorter. So they remove the headset. It's been 45 minutes, and patient said, "Already? Is it? We're already." They get that time contraction, which is really important. It means they were fully focused in the experience.
Yeah.
And if time seems to go by quicker, it means you're having a good time. Whereas if you're in pain and anxious, 10
It
minutes
seems
can feel
how
like
it lasts
an hour.
forever.
Yeah.
Wow.
And
I'll get
and
out of the appointment
overall,
saying,
just
when can I have my next appointment, please?
yeah.
Yeah. No, I love that. And thank you so much for sharing that because I want people to understand that a lot of times health professionals we think, okay, there's another thing that I have to buy. There's another thing I have to pay for every month. But based on what we just discussed right here, if you can save 5 to 10 minutes per patient, right? Let's just say you save 5 to 10 minutes per patient. This is based on what John has gotten from all his case studies and whatnot. Let's just say 5 minutes. Let's not say 10. Let's just say 5 minutes. I think it's gonna be a lot more, to be honest, but let's say 5 minutes there. In the course of the day, when you save all that time, that's actually you can have enough time to actually see one more patient. Imagine what you can produce with one more patient. Literally, if you think about it in that sense. Now, let's put that aside. Let's talk about the marketing aspect. Okay, imagine a parent, imagine a mom, okay, taking their kid out and they had that wonderful experience. Do you think that person is not going to tell all their friends that this particular practice invests in technology, right, that makes their kids' experience so much better? Do you think that they're not going to tell everybody? Now, imagine the new patients you would get from that. So we have two aspects right there. Now, let's add a third aspect here that John just brought up, right? The fact that we are taking mental health very seriously now, right? Like for a long time we have said, hey, just suck it up, that's our parents time. Now we've understood better that mental health is something that we want to prioritize just like our physical health, right? Now imagine the mental health of our team. You add those three things there, I would venture to say, Ian, that this pretty much pays for itself. In fact, you're going to
Yeah,
make money using this in your practice.
absolutely.
How do you feel about that, Ian?
This will increase your EBITDA. There is no question about that. And I could show study after study and case study and talk about that. But there is one other thing, and this is another big one. Think about all your no-shows and cancellations. Half of those are due to anxiety. They're afraid.
The kid
They
doesn't want to go. He the pitches a
they
fit and
just don't
doesn't want
want
to
to go.
come.
So, and think about case acceptance. Think about that first time you tell a patient that they're going to have a root canal. Oh my God, I've heard so many bad things about root canals. An extraction, an implant, all these things are anxiety provoking. And so what happens if they've already been in the chair with their hygienist using the VR, had a little filling with the VR, now all of a sudden they're not afraid.
Yeah.
And so when you tell them that they need that bigger procedure, that more invasive procedure, they're not afraid anymore. So you get that case acceptance and way less likelihood of that cancellation, which, by the way, on average right now for dental offices in the United States are pushing about $25,000 to $30,000 in cancellations and no-shows.
No, and again, thank you so much for bringing that up. And again, for those who are watching right now, and hopefully you guys are starting to kind of connect all the dots because it did for me once I actually put the unit on. So we're going to talk about that. I'm sure that's something that everyone's thinking about. Okay, we saw the unit. That looks amazing. But what are they looking at? Are they watching a movie? Are they doing something? What if it's a kid that likes to stay busy, right? Like think about kids nowadays. Like at least my son, if he's waiting around at all, he's doing something. Luckily for me, he's actually doing his homework when we're going back and forth from wrestling practice. But most kids, they want to do something. They just don't want to sit there. Jean, share with us what are the programs that they are actually going to see, and I saw that you alluded to we started with kids, but you and Ian kind of alluded to procedures that actually adults do as well. So talk about like this is not just yes we are very mindful of our pediatric patients, but let's be honest. The adult patients, they were pediatric patients at one time that had traumatic experience, and now they're scared, right? So you alluded to adult patients as well. So discuss what people are actually seeing and then talk about the adult applications as well.
Yeah, of course. So we have three types of experiences. So the first one is what we call action. So granted, this one is a bit more popular with the children, but it's also very popular with young adults who like the gamified aspect of it.
Yeah.
So this one puts you in an environment where you use only your eyes to look at the targets, and then you just use the trigger in one hand to shoot a laser at little germs or crystals or balloons. So it's a point and shoot mechanic, very simple yet very effective. And then the experience itself adjusts in real time to make sure that the content is always on par with your ability level. So it's never too hard, never too easy. What we want is to place the patient what we call the flow state. So the flow state is a really focused mental state. So and it's defined as the challenge is on par with your ability. So if it's too hard, you're going to get frustrated. If it's too easy, you're going to get bored. So we want to keep that patient in that nice flow state where all the brain waves, all the endorphins, all the serotonin and dopamine and everything secreted. It creates the perfect condition to block off anxiety and pain signals from reaching the brain. So that's the first one. So the action one. So we have different types of mechanics, but mostly head completely still. So we have the head still technology where if the patient moves, there's a tunnel vision that discourages head motion.
Oh, okay, cool. Yeah.
But then encouraging eye motion, so they aim using their eyes. We can also use other mechanics if that one's not the best choice. And then everything happens as the patient, as you look at them, they're completely still. And we heard dentists saying sometimes, is the kid asleep or what's happening? Because they're not moving at all. They're just sitting there and nothing's happening. But they're actually very much into the experience. And you can tell by looking at the tablet because you can see exactly what the patient is seeing. So once you start the application, it's like two, 3 clicks, but then you can just keep an eye on what's happening. You don't have to interact. But a lot of dentists, especially for kids, they like to comment, good score, because you can see it on the tablet as well. So you can keep having that conversation with the patient. They're not completely blocked off. And even though they get the sound from the branches on the side, because there's small speakers directed in the ear, patients will get the music and sound. but the ears are still clear if you need to give them instruction, talk to them. So it's not like putting them in a completely bubble that
Right,
you
right.
can
It's
get
not like a
in.
noise canceling headphones like
No, no,
we wear
no.
on the plane
Yeah.
where we can't hear anything. It's and I think also that makes them feel a little bit more safe too, I think. The fact that they're closed off but not completely closed off. And I love the fact that you guys can adjust the lens where you can see through and talk. And I can only imagine someone's doing a procedure on me and someone's talking to me, but I can't see them, right? So I
Yeah.
think that that's so important. So the game, so the traditional type of game, and then you said there was two other. What are the
Yeah.
two other experiences?
And then just to finish on the action one, there's a one that's dental themed. So there's tooth in environment, and then there's little germs throwing candies at them. So you
Okay.
do toothpaste to clean them, kill the germs, destroy the
So
candies.
they have an active so they feel like they have an active process. Like if they're getting some fillings done, they're doing
Yeah.
their part to get their teeth cleaned.
Yeah, exactly. It's very playful. It's very interesting, but it's also one that has a little educational piece to it, and it's as fun as the other ones as well. So that first one is clearly interactive. The second one is also interactive, but it's more puzzle, mind game, more meditative, more relaxing. But you need to also using your eyes and basic controls. You need to complete small puzzles that get increasingly more difficult. And we also adjust the difficulty level depending on their ability to finish these in a short amount of time. And it's wrapped in an environment that's calm and soothing. This one's great. We have
I
some
think adults would
children.
like this.
Yeah, that's it. So some children
They
like
might
it.
not want to take it off. They might want to keep playing the games.
Yeah, so teenagers, patient on the spectrum, also sometimes if it's within their what they really like to do, sometimes they get really absorbed in that type of experience, or young adults as well. And then the third one is the one that's more passive. So again, for adults, sometimes we have dentists using it for kids when they just want to have a soothing experience. Also works well in some cases, although action is definitely the more popular one. But it's think about going to the beach, going to in a beautiful forest, visiting temples, Egypt, Moroccan market, Japanese village, and so on and so forth. So there's different scenes. They change every 5 minutes, and you just go slowly into the scenes, moving around in a very calm environment with beautiful music. So with all these three experiences, each one of them has different content. So you kind of choose what the type of experience is, and then you can choose the content. We don't have 50,000 options to choose from because we want to expedite the process. If and then usually we say to the dentist, it's probably better if you choose for your patient and go like, hey, you want to go to the beach? All right, let's go to the beach, and then you just set it up. Because otherwise, if you doom scroll like you would do on Netflix trying to find a show, if you lose 5 minutes, it defeats the purpose
Defeats the
of the
purpose.
whole
Yeah.
thing really, really quick. So with these three experiences, we cover a wide range of different preferences in these applications.
So Ian, naturally, people are probably getting excited as they're watching this. And again, when I went through the demo, I really loved it too. And I know like pediatric patients would love it, but adults as well. Naturally, most dental practices and practitioners who are watching this right now, and they're naturally thinking like, okay, like how does this work? Do I have to buy the unit? How much does it cost? Talk to us about like the financial investments that are required for something. And again, we've already talked about how this literally pays for itself. So we're going to talk about actually how much it costs, and then you guys can kind of figure that out. And of course, is there a nifty deal? Of course, there's a nifty deal. But Ian, talk about like the investments from the practice level. What's this going to take for them to kind of get started with this program?
So first of all, we're very, very cognizant of, in general, any kind of apprehension of any new technology and what's my risk.
Yeah.
So what we do is we give a 2-month trial, which is virtually no risk.
Wow.
So it's a 2 month trial that dentists get to use. They do have to put a deposit down on the equipment, so it comes out to $1,595, and it is that's for the equipment. Then there is $129 per month for an SaaS license. And for that $129, you're getting the license, all the software upgrades, the warranty, training, and that's for a 39-month license. So if you don't like it after 2 months, and we rarely get anybody, it's one of the ones who don't try it that call us up and say, no, I'd like to return it. But if you don't like it, and for any reason, we take it back, you get your $15.95 back.
Wow.
You don't get the 2 months of the license, so you're paying $129 for the first month, the second month. After 2 months, you want to return it, we give you your
Now, what
$15.95.
if they say, I love it? What's the next step after that?
The just payments keep on going for 39 months. It's simple. There's no additional credit.
And then after 39 months, what happens?
So after 39 months, like with your iPhone or your Android,
Oh, there might be like an upgrade.
we'll have upgrades down the
Oh,
road,
okay.
probably in about midway through the license, or at the end of the license, if you prefer. If you don't want something new and you want to continue, we'll
Yeah.
have a reduced license because it won't have the warranty on it. But
Oh, okay.
the software upgrades. And if you don't want to pay anything more, you just get to keep what you have, the software that you have with no
Oh,
more.
wow.
So it's yours. You own
Wow.
the equipment day one.
Oh,
So
wow. So this is not like going on in perpetuity unless they really like it. They want the newest and latest thing. So, first of all, I love that, and I think Jean would also say he loves it too because being as doctors, we our lives revolve around evidence base, right? What's the studies? Give me the studies, right? Or we can't get studies. Let me talk to someone. Or you make it to where there's no risk, right? And I love the fact, and of course, speaking of, look, guys, this is again, I want to lead with the fact that this is not somebody who just was playing video games one day and he thought this would be great. This is actually a health professional, a physician who actually did like a study on this as well, but also has data with everybody else using it as well. So I love the fact that there's no risk there. John, talk about. I want you to add on that. Like, why was that important to you? I told you why it's important to me. Again, like I have like the doctor brain too. Like, give me the evidence, right? Like, it sounds great. Give me the proof, right? But for you, why was that so important for you to make that offer to say, hey, you know what, try it, and we will let our product speak for itself. Why was that so important to you?
Yeah, because it's new technology. It's something that people have kind of never seen before. I mean, there's the kind of the TV on the ceiling. There's a couple of like these non-pharma approaches. Although this one is in the same vein, but in terms of power, it's just more powerful because it's more immersive, it's interactive. And we understand, a lot of the dentists are actually business owners, and they need to make sure that before they commit to a technology or some sort of subscription, they want to make sure that it fits their needs. We saw in terms of people kind of trying it, Ian said the very few cases that the units were returned was when people just didn't bother using it. So that's one way, or just changing your practice or the way you work is hard. We all know that, and dentists are drilled to make it as effective as possible. Introducing a new tool, especially if it's right there on the patient, requires a little bit of effort and going off that inertia of doing what you used to do for the past 5, 10, 15 years. And also, we have some dentists who are really heavy nitrous users, which is, to everyone's discretion if they want to use it a little bit, a lot. So sometimes that might not be a great fit if a kid is nitrous no matter what. You could use both in the same time, but generally it's for people who say, I keep nitrous for the more difficult patients, or when this is the only option I have. But the best clients we have are figuring out that I can use VR for a lot of these cases and keep nitrous only for the patients who I cannot get good collaboration from them. And then you save costs because nitrous has gone up for just the gas, the equipment, the tubes and everything, keeping insurance, training, and so on and so forth. So we understand that you need to see the value of adding that tool, especially if you have other tools in your toolkit. It needs to make, and I don't want people to kind of get a subscription for something they don't like it, but they're kind of forced into a contract.
Sure.
I want the clients, which is almost all of them, if not all, satisfied, liking the product, talking to a colleague, saying, "Hey, I just got this device. I really love it." Because the best way for us to have more partners and clients is for word of mouth works really, really well. So, I mean, if people don't like the product, I would much rather they return it, say, you tried it, it's not for you, great. But if you decide to keep it, then you become convinced that it's good for you,
Yeah.
maybe from friends and other colleagues.
It's a win-win. It's a win-win. Okay, so Jean, you're on the Nifty Thrifty Dentist podcast. Ian has been on it, so I'm just gonna put this on Ian because you're new to this podcast. But Ian, look, you're in the Nifty Thrifty group. All my followers and people in my group and people who follow podcasts, they inevitably kind of wait around and say, okay, well, um, what's the Nifty deal, right? What's the special deal that we can get? Obviously, we already talked to you guys about how this literally is going to pay for itself. In fact, you're going to make money off of it. But if there's a sweet deal, it makes it even better, right? So, Ian, what can you do for our listeners, our viewers, and our community?
Well, the first thing we'd like to do is give you $14 off, so a little bit more than 10% off each month.
Nice.
Okay.
That's it, man?
No, yeah, you know me. I always
Okay, okay.
so also free shipping. Again, we
Right.
want to make this a risk-free offer for you guys. So free shipping. So it's not like you're getting $15.95 back out of $1,600 or $1,700. You're getting the $15.95 back if you decide to return it. If you
Yeah.
keep it, still free shipping, but free shipping as well.
And what else?
Oh, I knew you were going to ask me that. As well, we're going into Christmas season. A lot of practices are going to be closed for a couple of weeks. So we will extend the trial period to 3 months instead of two.
Oh, wow. Okay. So look, guys, I mean, if you pretty much people say that whenever you implement anything in your practice or business, right? Like you do it off of like a 90-day plan, right? In 90 days, you'll know. Honestly, I wouldn't even say 90. I mean, John, if someone was using it religiously for like 30, would you say within 30 days they would know if this is for them?
Yeah, so we do have kind of short meetings planned every kind of 2 weeks at the beginning just to make sure that they don't have any question, making sure that they position the patient well with the equipment. There's a couple of tips and tricks that we can share, and there's only so much information you can provide on the onboarding call. And we see that between it's people from like a week or two are comfortable using the tech and love it. But we see that it's usually between 2 and 6 weeks to really get comfortable. If you're making an effort to use it at least once a day or a couple times a week to get that experience going, because I would say the only challenge with the technology is getting comfortable around how you position the patient on your chair. So you want to make sure that this part here, which kind of feels like a small pillow, fits nicely in the headrest, that the patient has a good neck extension, and that you can see well. Because one thing we didn't mention is that dentists should not have to modify the position that they work in order to work around the headset. All our clients, at the beginning, sometimes they have a tendency to change a little bit, but we say, no, you should definitely position yourself and work exactly the same way you did without the headset. And it's actually kind of comfortable because you can, first of all, go over the patient's eyes because they're in the jungle or they're doing a game, they're somewhere else. So you don't have to go around the patient, so for the shoulder as well. And so we tell them, don't try to go around it. You can rest your wrist or your hand on the headset. It's rigid all the way to the back. So even if you put a little pressure, patients don't feel it.
Yeah.
But to get comfortable, we need to go through these and you need to use it a couple times for those tips and tricks to make sense. Because if we just throw it all at you at the beginning and then you start using it, you kind of forget all about what we said in the initial call. So we just want to make sure that they get on the regular calls. 2 to 4 weeks is usually more than enough
Wow.
to really
Yeah.
start getting comfortable. And then you become an expert within the 2 months. After that, people use it 3, 4, 5 times a day, and they love it.
Well, and the fact that the deal is they extended an extra month there. So really, there's no excuses, guys, right? Like if you really try it and if you really don't like it, then they understand. Like that's why we have this deal in place. But you heard it from the doctor himself, right? You do this in 2 to 3 weeks, you're pretty much ready to rock and roll. But they're there to give the support as well, and I think that's always important. Okay, so before we end the podcast here, Ian, what is the best way for people who are like, okay, I want to take advantage of this deal. I'll try it out. I'll take the challenge, and I want to see if everything that Glenn and John and you said is actually true. They want to take the challenge there. What's the best way for them to get signed up?
Easy as can be. Paperplanetherapeutics.com. That's paperplanetherapeutics.com. Click on the dental section and either fill out the form, set up an appointment right online, whatever's good for you.
And is there somewhere that they can designate like this came from Nifty Thrifty or anything like that? Or is that something they would tell you guys when they talk to you?
Yeah, just let us know that it
Okay. Because we want to take advantage of that deal, guys. So make sure you mention that. But
they can put it in the comment section when they book. There's
section.
a little box when they like added comments. So just put in there or say it on the call, and we'll definitely extend that offer to them.
Now,
Awesome.
they can also reach me at i.miller@paperplanetherapeutics.com. They can call me at 877-677-5277. That's burned into everyone's mind right now. 877-677-5277.
And guys, let's be professional here. Don't get his number, put it in the bathroom wall for a good time call Ian. Let's make sure we don't do that. But guys, thank you so much for jumping on. I'm super excited about getting this into more hands. And honestly, I want to try to get it in my own practice as well. But I'm super excited about getting this into the hands of other dental practitioners, because at the end of the day, it's going to make our patients' lives a lot easier. And of course, we're going to win as well, right? We already talked about that as well. So guys, thank you so much for jumping on, and we'll see everyone next time.
Thanks so much.
Glenn.